If you're a senior, you might assume that the swelling in your ankles or the heaviness in your legs is just part of aging. But what if those everyday discomforts were actually early warning signs that your heart is struggling to keep up? Right now, more than 6 million Americans are living with congestive heart failure, and a shocking number had no idea until the condition became life-threatening. Why? Because heart failure doesn't always come with chest pain or dramatic symptoms. Instead, it creeps in silently, starting with subtle changes in your legs and feet. A little swelling you blame on salt, cold feet you chalk up to poor circulation, fatigue in your legs after walking just a short distance. These could be your heart's first cries for help, long before more obvious symptoms appear. And here's something even more alarming. According to the Heart Failure Society of America, this isn't just a senior issue anymore. Congestive heart failure is now affecting people of all ages, and is becoming more common among younger adults than ever before. So if you're thinking, I'm too young for this to be a concern, think again. Nobody is truly in the clear. In today's video, we're exposing 9 surprising signs of heart failure that show up in your legs and feet, and why catching them early could save your life, or the life of someone you love. Before we start, please hit that like button and subscribe to the channel to help this life-saving information reach more people who could benefit from it. Without further ado, let's get started. 1. Leg heaviness or fatigue. That dragging, heavy feeling in your legs, especially after mild activity, might not just be age or poor circulation. It could be one of the earliest signs of congestive heart failure. Here's why. When your heart begins to fail, it struggles to pump enough oxygen-rich blood to meet your body's needs, especially to your extremities, like your legs. This poor perfusion means your leg muscles aren't getting the fuel they need, leading to fatigue, weakness, or a heavy sensation, even without intense exertion. A study published in the Journal of Cardiac Failure found that muscle fatigue in the lower limbs is common even in the early stages of heart failure, and it's strongly linked to reduced cardiac output and oxygen delivery. This symptom is often overlooked because it feels so subtle, but if your legs tire easily or feel unusually heavy, it's worth paying close attention. Your heart may be struggling behind the scenes. 2. Cold feet and toes. While you can get cold feet for harmless reasons like cold weather, poor circulation, or even sitting too long, chronically cold feet and toes could be a subtle but serious warning sign of congestive heart failure. When the heart weakens, it prioritizes sending blood to vital organs like the brain and lungs. That means less blood is delivered to the extremities, especially the feet and toes, which are furthest from the heart. This reduced blood flow leads to a drop in skin temperature, making the feet feel constantly cold, even in warm conditions. In fact, research published in Circulation showed that peripheral hypoperfusion, or reduced blood flow to the limbs, is a common early finding in patients with chronic heart failure. If you find your feet are often icy to the touch, or feel unnaturally cold while the rest of your body is warm, your heart may be struggling more than you realize. 3. Skin discoloration, reddish or brownish patches. Have you ever noticed someone with reddish or brownish patches around their ankles or lower legs, and just assumed it was a skin condition or old injury? In many cases, those dark patches could be a silent sign of congestive heart failure. When the heart can't pump efficiently, blood begins to pool in the lower legs, especially around the ankles. This increased pressure can cause capillaries to leak, releasing red blood cells into the surrounding tissues. As the body breaks them down, iron from the blood pigments the skin, leading to a rusty or brownish discoloration called hemosiderin staining. Studies in journals like Heart and Lung have linked chronic venous congestion, common in heart failure, with skin changes that are often misdiagnosed or ignored. So if you or someone you love is developing unexplained red, purple, or brown skin patches on the legs, it might not just be a skin issue, it could be your heart trying to speak through your skin. 4. Tingling or numbness in legs and feet. Tingling or numbness in your legs and feet is easy to dismiss. Maybe you sat too long, crossed your legs, or wore tight shoes. But when this sensation becomes frequent or persistent, it may point to reduced blood flow caused by congestive heart failure. Research in current cardiology reviews shows that peripheral neuropathic symptoms can appear in people with heart failure, not from nerve disease itself, but from impaired blood supply. 5. Difficulty wearing shoes. If you've noticed that your shoes suddenly feel tight, especially around the ankles or the top of your foot, it's not just about weight gain or shoe size. It could be a silent sign of fluid retention from congestive heart failure. As the heart weakens, it struggles to pump blood efficiently, causing fluid to back up in the lower body, particularly in the legs and feet. This leads to swelling or edema, which often makes shoes feel snug or uncomfortable, even if they fit perfectly before. According to the American Heart Association, foot and ankle swelling is one of the most common early signs of heart failure, often noticed when people say things like, "My shoes don't fit anymore," or "I need looser slippers now." 6. Varicose veins or bulging veins. So what are varicose veins, and why should you pay attention if they appear or worsen suddenly? Varicose veins are enlarged, twisted veins that are often visible under the skin, usually in the legs. While they can be caused by genetics or standing for long periods, new or worsening varicose veins can also signal congestive heart failure. When the heart struggles to pump blood efficiently, pressure builds up in the veins of your legs, forcing them to expand and bulge. This pooling of blood not only leads to visible veins, but can also cause discomfort, heaviness, or swelling. Research published in cardiology clinics highlights that venous congestion in the lower extremities is common in patients with early heart failure, sometimes appearing before other symptoms like shortness of breath. 7. Leg cramps or pain while walking. Don't get this wrong. Leg cramps can result from magnesium or potassium deficiencies, dehydration, or simply overexertion. But if cramps or sharp pain show up frequently while walking or even at rest, it could be an early sign of congestive heart failure. Because the heart isn't pumping efficiently, your leg muscles may receive less blood and oxygen than they need, making them prone to cramping, aching, or fatigue, even during mild activity. Research in the European Journal of Heart Failure shows that exercise-induced leg discomfort is common in early heart failure. 8. Slow healing sores on feet. Slow healing sores on the feet are often attributed to insulin resistance, diabetes, or poor circulation. However, they can also be an early warning sign of congestive heart failure. When the heart's pumping efficiency declines, blood flow to the extremities diminishes, leading to slower delivery of oxygen and nutrients essential for tissue repair. This compromised circulation can cause even minor cuts or blisters to heal more slowly, increasing the risk of infection. Moreover, insulin resistance is closely linked to heart failure. It contributes to vascular inflammation, endothelial dysfunction, and arterial stiffening, all of which strain the heart and exacerbate circulatory issues. This creates a vicious cycle where poor circulation hinders healing, and delayed healing further impairs circulation. A study published in JAMA Cardiology found that patients with heart failure often experience impaired wound healing even before more obvious symptoms like swelling or shortness of breath appear. 9. Pitting edema. Now this is a big one, so what exactly is pitting edema? The easiest way to check is to look at someone's swollen feet or ankles. Press your thumb gently into the swollen area and then remove it. If a dent or pit remains and takes a while to bounce back, that's pitting edema, hence the name. Pitting edema occurs because blood and fluid start to pool in the lower legs and feet. This happens when the heart can't circulate blood efficiently throughout the body, causing fluid to leak from the blood vessels into surrounding tissues. What to do if you have heart failure? The first thing you should do is get thoroughly checked to find out what caused the heart failure. Is it high blood pressure, coronary artery disease, diabetes, or another underlying condition? Understanding the root cause is crucial because it guides the best treatment plan. With your healthcare provider's supervision, you can ask about strategies to protect your heart and improve circulation, including managing blood pressure and blood sugar. Keeping these in check reduces strain on your heart and helps prevent fluid buildup in your legs and feet. Medications. Doctors may prescribe medications that help your heart pump more effectively, remove excess fluid, or control arrhythmias. Lifestyle changes. Gentle physical activity, like walking in a safe environment, can strengthen your heart and improve blood flow. Reducing sodium in your diet helps prevent fluid retention. Monitoring weight and swelling. Keeping track of sudden weight gain or increased swelling in your legs or feet can help detect flare-ups early, supporting heart health naturally. With guidance from your healthcare provider, adding magnesium, potassium, or omega-3 rich foods can support heart function. Staying hydrated is also crucial, but too much fluid may need to be limited depending on your condition. Heart-supporting supplements, only with medical approval. Certain supplements may benefit heart function, including CoQ10, supports energy production in heart cells and may improve cardiac function. Magnesium helps maintain a healthy heart rhythm and blood pressure. Omega-3 fatty acids reduce inflammation and may improve cardiovascular health. Potassium can help regulate heartbeat, but must be carefully managed to avoid dangerous imbalances. The key is that heart failure doesn't mean giving up on your life. With proper management, early detection, and consistent medical care, many people see improvements in symptoms and quality of life. Remember, always consult your healthcare provider if you notice any of the signs we've discussed, whether it's swelling, numbness, cold feet, or slow-healing sores. Only a medical professional can accurately diagnose the cause and guide you toward the safest, most effective treatment plan. If you found this video helpful, please like, share, and subscribe so more people can become aware of these life-saving signs. Don't forget to hit the notification bell so you never miss crucial health content that could protect you or someone you love. Your heart is your most important asset. Listen to it, care for it, and act early.